first of all, going towards the European health data space is a long journey, and at the same time, it's a journey that we have been embarking on for a couple of years now. So we are, so to say, not only at the end of the journey, but at the new page of a new history for Europe in health. And of course, the role of the presidencies is key in driving this agenda, because we are currently negotiating the text about the European health data space. And we had the honor on the French side to start a little bit this exercise, because the proposal was issued by the Commission at the end of the French presidency a couple of months ago now. Now in the safe hands of the Czech Republic, and moving towards our Swedish colleagues in a few days from now. Just to set up a little bit the context in France, France has been supporting this concept from start, and it's very important to say. It doesn't mean that we do agree in the negotiation process with every step and everything in the proposal, but this is something that we believe is really necessary for Europe. So we have several challenges that we are going to meet thanks to that text, and that's at least the purpose. So we have health issues, and we just spoke about the health data. The combination of health data at European level, reaching the European scale, is key. The sovereignty issue, also the digital agenda, and under that flag, I would say that I'd like to also say that we have a responsibility in health, because we are the first European data space to start. So we have to succeed, so to say. Otherwise, it will be compromising other sectors, which is not good. And of course, it's going to bring concrete solutions for citizens. And it's very important to remember that it's not an issue from a political level. It's also about developing services for European citizens. So those are key elements, I would say, for a good recipe, probably, and but also it translates for most of us in a lot of work. And we have been engaging in France on both sides of the proposal, the primary use of data. We are not as far as other countries, but however, we've started a first first service, for citizen, which is the fact that health professionals in France since July 2021 can access the patient summary of EU citizens that are treated in France, of course, with the consent of the patients. So this is one of the first use cases that has been implemented under the European Health Data Space. So this is My Health at EU. And of course, all the joint actions that are also preparing the floor for that, we've been part of them. And on the second side of the European health data space, we have been also actively engaged. We created a couple of years ago now the Health Data Hub, and the Health Data Hub has now been chosen a couple of weeks ago by the European Commission to be leading the consortium of 16 partners driving the pilot of the second part of the European health data space. So this is, for us, already part of our, I would say, daily reality to be part of the European health data space. The proposal will make things mandatory. Now it's voluntarily, which is a big difference. And of course, what we just spoke about regarding interoperability, for instance, are key elements that will be imposed to member states. However, we have, so to say, already some experience in that. We are currently working on how we are preparing. We are also preparing the entire ecosystems, because not everybody is already engaged in this. Key people, yes, but not the entire health ecosystem. So we have a public consultation that is open since a couple of weeks. We are doing webinars, for instance, and we are talking about what is the know the current reality and what will be the next steps about the European health data space and what the regulation will change in the entire ecosystem. So this public consultation is also going to support the French position, because under the having said that we are globally supporting, as I said, we have also some key elements that needs to be fine-tuned, and it will be extremely important for us to get the support of the entire ecosystem. We have already received a lot of contributions. But if I go to the French reality, we are. I love to start with these small pictures. It's a major challenge for Europe to go to EHDS, and we in France we have for the digital health strategy we are applying the theory of smaller steps. So every concrete step that we make help us to move forward, and sometimes it's very important in order to reach the right level of ambition. We have a complex ecosystem, like in every single European country. However, all parties need to partner to build the European health data space, and that's very important, both at national and at regional level, because we have also an organization which is quite centralized, but with also regional support. This is the picture showing the evolution of the French digital health roadmap since the beginning in 2019. We have finalized the 3 first years of the digital health roadmap. We are switching to a new one, and you see that as a first sign that I hope is obvious in the middle of the picture is that we are also moving to be much more Europeans, and that's the EHDS proposal is of course a key element in that. I'm not going to comment the orientation of the digital health transformation in France per se, but I'd like to stress, better say, the first orientation was to strengthening the governance of digital health, and also the other orientations you could, I would say, almost replicate them at European level. And it's very important to bear in mind that a lot of the changes that will occur at European level are going to impact the national level, but also the national level from every single European country must support and help building the global picture at the European level. We were quite lagging behind in terms of digital health in Europe, and for that reason, this roadmap has been implemented, and with several action plans. I would say those are prerequisites for us to build the European health data space and to be part of it. And I believe that this is something quite similar in every single country. So the national roadmap, so to say, is preparing the floor for the European health data space. We are quite often mentioning interoperability as a key building element of the European health data space. If you do not build that at all levels, it will be a nightmare and a failure. And we need to accelerate that at regional, at local, at regional, at national, as well as at European level. So part of that was the Ségur numérique, which is basically the French name of the Recovery and Resilience Plan at European level. What are we doing with the European financing? We are upgrading all softwares in France in the health ecosystem in order to have the right secure technical bricks allowing for interoperability. At the same time, we had also some other initiatives. I will come back later on that, because so it's a long journey. It has started in 2000. 18-19. We had a key moment with the French presidency, as I said, in the first semester of 2022, which has been also very supportive in building and in driving the path to the European health data space, but much more also initiatives in AI, in a digital health acceleration plan, together with the Ségur de la Santé, and the creation of a unique campus for digital health in Paris, Paris Santé Campus, and that some of my European colleagues had the opportunity to visit during the French presidency. So the digital health acceleration plan is targeting, I'm not going to comment everything, but is targeting key elements also. It's part of the vision for France in 2030. And one key element in building the European health data space is also to make sure that you have the right level of skills available. If we do not have the digital health skills and competencies, it's impossible to drive the huge change management to come. So one burning platform is really to start this, and this is maybe something we do not speak much about in general, in all symposium and conferences, but this is really something which is a prerequisite to move forward. So it's part of this acceleration strategy that does much more than that, but however, this element has been very important. Also, during the French presidency, we made it also very clear that the European health data space is going to also be the creation step of a digital single market for health in Europe. And it's probably a subtitle, but you need also to be very much aware of that. So that means that we have been taken some elements also to build, to increase the market access. Technical interoperability, we were one of the last countries not to have adopted yet SNOMED City, and we took also this way. And of course, a key, and I will end up with that regarding the French presidency, we also shared the concern that this European health data space had to be prepared in a way that would ensure the trust of the citizens. And that is the reason why we have been formalizing something which was part of the European DNA, the fact that we want a digital health according to our European values. So we have proposed, and European ethical principles were adopted unanimously within the YELS network during the French presidency, and some parts of them are clearly replicated in the proposal that has been submitted for the regulation. So part of the digital single market I was mentioning is also to have some small steps, to move forward in some areas, like harmonizing evaluation criteria for digital medical devices. And you know that digital medical devices are part of the scope of the EHDS, and also putting light on the way of entrepreneurs in digital health, because we still have various ecosystem, and it's very difficult to find its way. So that's what, so this is about the digital medical device. We have started a task force, and regarding putting the light for entrepreneurs, we have expanded a solution that was developed at French level for an entrepreneur to know what to do in the digital health market. And we have extended as an international service, and we have already 10 services live. All of those initiatives are building blocks for the European health data space that are aside of the regulation for some of them, but all meeting the same purpose. So in a nutshell, this is basically how we get prepared. And as you may have understood, a key element for us is to prepare the entire ecosystem, because we believe that it can be a success only if everybody gets ready for it. Thank you.